first week in April. Scott Stevens, James City County Administrator. I'm here with Neil Morgan, Andrew Trivette, and Dr. Steve Julian, our acting Peninsula Health District Director. We've all talked an awful lot these last few weeks, and we want to reach out to the community for questions, which you've sent us. We thought we'd just say a few words, and I'm going to kick it over to Neil Morgan and let him say good morning, and then down to Andrew Trivette with Williamsburg, and then we'll let Dr. Julian carry us through. So, Neil, all yours.
Hey there. Good morning, everyone. Dr. Julian, we appreciate all of us in the historic Triangle communities, appreciate all the work that you and the team at the health department are doing, and appreciate you taking your time to fill us in today.
Good morning, Dr. Julian. Good morning, Dr. Julian. We appreciate you taking the time to be with us this morning. And certainly this is an odd set of circumstances, and the Department of Health, I think, is guiding us through it brilliantly. And your leadership has been instrumental in keeping us all informed, and certainly is a key component of our community's understanding of this disease and situation. So thank you.
Yeah, and I would just say, Dr. Julian, we all have talked daily, if not more than that, between the localities and with the health district. And I would echo Andrew's comments that it really have been a good team, and we really do appreciate that. I think I'd like to turn it over to you and just let you sort of give us your viewpoint from the health department and what the current situation is and what our communities ought to be doing and our residents ought to be thinking about going forward.
Well, thank you so much. I really appreciate the opportunity. I appreciate your kind words. I think one of the first things I'd say is that it really has been a team effort, and I really appreciate the back and forth communication that we've had. I think it's been critical for dealing with this pandemic threat that we have. And so I very much appreciate it. Also, I appreciate the communication I've had with the EMS services. That has been excellent, and with the first responders, including police. The establishment of the EOC, Emergency Operations Center, a few weeks ago, I think was a key component to our response. And I think it has just worked out tremendously in terms of having everyone on the same page and organized in this response. First, also, I guess maybe second, I want to thank the community for how well people have responded to the governor's requests and the governor's orders to socially distance and to stop the schools and to stop all of our routine activities and keeping only with essential activities. And even when we do, social distancing, keeping 6 feet apart. I think additionally washing hands, hygiene is so critical in this fight against this virus. It's just it's been gratifying to see, and I hope that's going to have some positive effect, and maybe it is, and we'll talk about that in a few minutes.
Well, very good. Do you sense an end to it, or have you gotten to that point in terms of prediction for us yet?
Yes, and I'm glad you went there, Scott. So first off, we have a multitude, 3 or 4 predictive models that many people are now using nationwide. We have not settled on a predictive model in Virginia yet. University of Virginia is working on a predictive model that the VDH plans to adopt. But in the meantime, there are some good models, and I think the key to those right now, and I'll be glad to provide you guys with those websites to take a look at them. And you can let viewers see also, because they're public websites. The good thing is, if you looked at I've been looking at it daily, of course, and if you looked last week, our model for the peak of this pandemic was probably the end of May. However, I think with the social distancing and things that we're doing properly, the models now are moving that backwards to probably a peak somewhere around the last week in April. So that's probably a good thing. Now, we all have to remember a model is a model. And it is, if there was a perfect model, there'd only be one. But unfortunately, there are multiple ones out there. And so we're just going to have to see. Time is going to tell. I think Dr. Anthony Fauci with NIH has said the virus will decide the timeline, not us. And I think that's unfortunately true. But I do think that the things that we can do and that we are doing, not visiting hospitals, not visiting nursing homes, social distancing, hand washing, hygiene, and I think all the things we're doing with the executive order are going to bend that curve down, which is a very good thing. It will decrease the number of deaths that are involved in this pandemic, and it will decrease the severity of it, and it will also keep the pressure or lessen the pressure on our healthcare system for beds, ventilators, etc.
Very good. Well, we did solicit questions from our residents out from York County and the city of Williamsburg and James City County. And I guess I'll kick off those questions and we'll run through and
Sure.
see what you have for us. So I have a question from Vivian. If a person contracts the virus, how long are they sick, barring complications? And then if a person gets the flu, for example, they're typically ill for 10 to 14 days. So again, is that the case with the COVID-19?
Okay, well, there's a good answer to that. The answer is it is variable between people in the sense that all of us come to have, if we have this problem, we come to it with a different set of physical, emotional, and mental circumstances. And so we come at it with different ages. So in general, and what we've learned from around the world, is if you have the mild case, you're probably sick for about a week. And the severity of the illness can vary. If you have a more severe case, probably in the neighborhood of 10 to 14 days. And if you have a very severe case, the average length of stay in the hospital now with this is up as many as 20 days. So if you have a severe case, have to go on a ventilator, something of that nature, you're probably looking at about almost a month hospitalization. So that's the story.
Thank you, Dr. Julian. So the next question comes from Tom, and he wants to know, if you've had the virus, can you get it a second time?
That's a great question. One of the things that we are looking at, Drew, is the course of time. And by that I mean, what the public is seeing right now is the working out of the understanding of a disease process in real time, very publicly. Not what normally happens. Normally, healthcare systems and physicians, nurses work out the understanding of the course of a disease, and then we're able to inform the public. It's known. We can look back historically. So, for instance, the standard flu, we can look back at the flu from previous years. But this is the first year of COVID-19, so we don't have historical precedents. In general, we think, and this is subject to change and study, we think that you get it once and then you develop an immunity like you would to most viral infections. But it is absolutely not 100% known at this point in time.
Thank you.
So Dr. Julian, Gail wants to know the same thing a lot of us want to know, which is when do you anticipate that our area will have sufficient tests so that anyone who wants a test can have a test?
It's the concern that we all have. And the ideal state, Neil, is for us to have testing available for everyone. The other part of the ideal state would be for it to be rapidly returned in terms of an answer. So we have that for the flu, for instance, ubiquitously available and rapid turnover, no within an hour. Unfortunately for COVID-19, we're not in that situation. There is a lag anywhere, probably at best right now, 24 hours from the time the test is done. And I've heard worst case scenarios as much as 10 to 12 days. Most of the time it's about 5 days. And that's due to the way the test is done. It's due to the volume of testing that is being done. And it's due to lab capacity. And also, believe it or not, transport time. Because as opposed to the rapid flu test, which is done right there as a point of care testing in a hospital or urgent care, we do not have that capability currently with COVID-19. So literally the specimen has to be taken with a throat or nasal swab, and then it has to be processed, or it has to be packaged, properly managed, and sent to a lab to be done. And so there's a transport time, so that adds additional time. To go directly to the heart of your question is, when will we have enough? And I don't think we know yet. I do know that as of yesterday, we've had over 1,400 tests done in the district at the various locations. I do think it's getting better all the time. I do think the availability is becoming more appropriate, but it is not available as much as we need it right now. Also, the testing is getting better, and the turnover times are getting better, and more labs are coming on board. So that will decrease the turnover time. But I don't think we're there yet, and I think it'll be a while until we have universally available testing like we do with flu.
Dr. Julian, the next question comes from Gail again, and I think you actually just answered it, but I'm going to go ahead and ask it just in case there's anything you want to add. And then Gail has a third question that I'll roll right into. So
Sure.
She wanted to know, why does it take so long to get results, and when will that improve, and if so, when?
Yes. So again, it has to do with obtaining the specimen, appropriately managing the specimen, and transporting it, and then getting it to a lab. These are molecular tests that you have to have a lab that's equipped to do that. And of course, right now there is a huge influx of tests coming to the labs that are set up to do this. And so that's the main reasons. I think, I think it is going to get better. I think it is getting better, but it's just going to take a while to have it done. What we need is a rapid assay like we have with flu, and people, scientists and universities and so forth are working on that now, but there is none that is FDA approved and sanctioned at the moment.
Okay, thank you. So Gail's third question was, when will we have access to antibody testing so we will know whether or not we are likely immune?
Sure. So there are a lot of people working on that right now. We got some guidance yesterday. There are some antibody tests, but they are not specific enough or accurate enough at this point for us to really use them universally. Also, believe it or not, it's just like the COVID testing, the assay we were talking about just a minute ago. You have to have the right equipment, machines. You have to have the right media, and there are things called cassettes. They're little plastic things that these tests are run in for the antibody tests, and they are in short supply right now. So again, it's a supply and demand issue. It's also an accuracy issue. At the present time, these assays are in development, and they probably are giving a significant number of false negative assays, which means that it suggests that you haven't had an antibody response when you really have. And so that's one of the major things that you've got to make sure in terms of quality control, is that your testing is accurate. And so we're not at the accuracy level yet that most physicians, nurses, and scientists are really comfortable with. We're going to get there, but we're just not quite there yet.
Thank you.
Dr. Julian, you spoke to this a little bit in your introductory comments, but Larry and Mary have a question about the peak of the virus, and you spoke to the latest model evidence for this area. The other part of their question was, how is it going to be different in this area than as for the country as a whole?
Sure. So again, there's one, one or two, three really good websites that you can go out there and see different models, Neil. They are changing. So for instance, if you look at it last week and you look at it this week, the curve is moved back. By that I mean the peak of our pandemic here was originally predicted in one of the frequently used models as to late May. And that was last week's data. If you look today at that same model, it has moved it back to the third or fourth week in April, wherein we might see the peak. And I think this is related to us doing the appropriate social distancing and hand washing and so forth that is decreasing the severity of this illness in our region. We do not have specific data to the region. That's being worked on. But not available at this point. But I think we can look at the national models and apply them pretty closely to what we've got going on here. We had an initial early entry, I guess I would say, into this problem. And I think that actually that's a good thing in the sense that I think our clinicians, our doctors and nurses were aware. I think we did a lot of early testing. with the testing availability that we had. And then we did something that was really important that people don't even see. It runs under the surface, and I think the public doesn't really get to understand. We put the VDH epidemiologic teams, that's kind of a mouthful word, but what that is people, they're usually nurses or they're trained epidemiologists. You can go to school to be one of these folks. And they interview all the people that have the disease, and then they track all their contacts. And in contact tracing has been done very, very well here in the district. And so very dedicated teams working literally sometimes 18, 20 hours a day to make sure that we track everyone. Once we track people down, then we warn them that they've been exposed, and then people can know to quarantine, to self-quarantine, one of the other social distancing things we've been talking about. That will definitely reduce the spread of the disease.
Very good. Thank you, Dr. Julian. A question from Blair. When will recovery numbers be posted?
It's a great question. I think we can all look on the CNN every day and see that recovery numbers are posted there. We can look on the Johns Hopkins website, and recovery numbers are definitely posted there. However, the VDH at this point does not have those numbers for us. They're working on that availability. I hope we'll have it in a couple of weeks. But right now, it is not posted by the VDH because they feel that the numbers are not accurate enough to feel comfortable that we're giving you good information. In addition, I understand the question and the desire to know, and there are people recovering. That's a really good thing. You can go to the VHHA website that was set up yesterday, and I can provide you guys that website. That one has more information and should probably sooner have the recovery numbers, because those numbers are going to come more accurately from the hospitals than they are from the VDH.
So, Dr. Julian, the next question comes from Blair, and he or she wants to know, why are we not seeing more details about positive cases? And they go on to note, other districts are releasing info on where the person traveled, what the contacts were like, and whether it was a known or unknown community spread. And they don't understand why we can't get similar information here in the Peninsula Health District.
Sure. Number one, it is the policy of the VDH not to give out publicly people's name, address, and location for an infectious disease. That is a privacy issue for our citizens. However, we do have data that is shared with our emergency medical services and our first responders. We also have what we call a heat map, which we have shared with all of our county administrators, and they're able to see where things are flaring up. I think the most important comment I can make, though, to this question is we definitely have community spread. And so if you knew it was a pocket on James City Street or Smith Street or whatever, that would give you actually, for the public, a false sense of security. Because when you do the tracings, the epidemiologic tracings that I was talking about, we find that people travel and move about incredibly in this region. It's probably one of the reasons why folks in the Triangle area have experienced a high number of cases, is because we have a population here that is able to travel. It does a lot of social interactions within their communities, a lot of church going, which is a great thing. But under these circumstances, it spreads the disease. So I think, were we to put those numbers out, I think we would be violating some people's rights, number one. And number two, out to the public. And number two, I think it would give everyone a false sense of security that would actually lead to more spread of the disease.
Thank you.
Thank you, Dr. Julian. Similar question from Hiram, but the question is, why is James City County leading the Commonwealth by such a huge margin in both positive virus tests and fatalities? And then not talking just of all numbers as reported by VDH, but the important statistic of the per capita infection rate. And again, you did answer some of that, but I don't know if there's anything to add to that.
Sure, let's talk about that a little bit. Because number one, I don't think we know anywhere the per capita infection rate. Because to know that, you'd have to have universal testing. And we do not have that. So that's comment number one. So we don't know. I think, comment number two is, I think it's related. I think why we've had sort of an outbreak in the region here, especially in the historic Triangle region, is related to the nature of our population. And by that I mean the general age of our population is a little bit older than average. I think also the ability to travel is a little bit more common in this region. I think if you look at Virginia and other areas, Northern Virginia, where there's a lot of, which is the highest number of cases in that area, think about it. That is going to have an incredibly mobile population. It's going to have military moving in and out up around the DC area. Think about our area. Same thing. We have a very mobile population, a very active population of seniors, and we have a significant amount of movement in and out of the area of military. It's done quietly, and I think we're all just so used to it. We're used to seeing the airplanes and the jets and the helicopters and think nothing of it. But I grew up over in the western part of Virginia, and you never saw that kind of thing there. But here, it's commonplace, and we just, I think we see the bumper stickers, I heart jet noise, and I think we're just used to it. So I think we have a lifestyle here and a population demographic that makes it kind of almost the perfect place for this to happen.
Well, very good, and I appreciate that. One more question from Gail, and that might wrap up what we've got prepared. But is James City County still considered a hot spot, or was that an artifact of a lot of early testing in James City County compared to other parts of the state?
That's a great question. I don't think it's an artifact in the sense that I think it's beneficial that we did do a fair amount of early testing, and our clinicians, again, were very astute to think, hey, this could be spreading to our area. Hey, we know our populations and the circumstances in which they live, act, and communicate, and we think this could be a high-risk area. So I don't think it's an artifact. I think it's real, and I think in our region, and that's I guess one of the main things I want to get across today. It's why all of these actions that we keep harping on over and over about our social distancing and having everything shut down like we're doing is so important, because when we don't have a vaccine, which we do not have, when you do not have medications, antivirals that are helpful for a disease, the thing that you have to do to decrease hospitalizations, to decrease severity of illness, and to decrease the pressure on our health system, and to flatten the curve, is you have to socially distance and keep people in isolation together, as we're talking about. It's hard, but we need to use our technology, our FaceTime, just like we're doing today. I think today is a really good example. We're all in, 4 different places. Right. We're doing this by video. So this is a really good example of how we need to interact during this time. There will be a time when we can get back to our former lives and former ways of interacting. But even when we do that, I hope we have a vaccine so we don't get a second wave of this problem. I hope that we do keep the ideas of good hand hygiene and social distancing to an appropriate level to keep this from spreading.
Very good. I really appreciate that. I guess we're done with our formalized questions. Neil, Drew, anything to add in terms of questions or comments before we wrap up?
Well, we had one other one from Sarah, who asked the question, can you talk about of the number of people who test positive, what's the proportion that don't have to go to the hospital, and of those who go to the hospital, what proportion has to be on a respirator? Kind of what's the proportional breakdown? Sure.
So that's a good question, Neil. It's a little hard to straightforward answer, but let me try. First off, everybody has been warned of the symptoms. Shortness of breath, fever, cough, and what we have wanted people to do is to self-isolate when they start to develop those symptoms. Additionally, if they become severe, then a person needs to contact their medical provider and get good direction and help. It comes to another thing. People talked a lot about the drive-in or drive-through testing. Well, I want to kind of say one thing about that. It was never really drive-through or drive-in testing. It was drive-through screening. The way those things were set up was to, bring people through, ask them all the appropriate questions related to the clinical characteristics of the disease, and then decide, based on medical judgment, as to whether a screening test needed to be done or not. So I think that still applies. Certainly, if, what we are saying to people now is if you're feeling, like you have those symptoms or you're concerned, contact your medical provider. If you don't have one, then, urgent care or emergency rooms are the next best choice. But even then, to do things appropriately, you really need to call ahead and talk to someone at those facilities and describe your situation and symptoms. The other thing I'll mention in terms of that is I've been in touch with a lot of the medical groups here in the region, and they are doing tremendous numbers of video online communications now. I can't remember the exact numbers. I was talking with the chief medical officer of the Tidewater Physicians Medical Group, and the number of online interactions that they are now doing has just skyrocketed. And I think that'll change for the future, quite frankly, which is not a bad thing. It'll probably be cheaper, simpler, more convenient, and better understood. So maybe that's one good thing that'll come out of this. So I think those are the comments I would make. Certainly, if you're feeling ill and you're concerned and you need to seek medical care, by all means do it. The last thing is, how long are you going to be sick? How many people end up on the ventilator? It's actually about 80% of people have a mild to moderate disease process and do not actually have to go into a hospital and be hospitalized. Currently, it's only about 20% who need to be hospitalized. And of that 20%, it's probably somewhere around 15 to 16% who end up on a ventilator at the present time.
Well, I'll just close out my comments by, saying that on behalf of the citizens of York County, we appreciate what you, Dr. Julian, and your team are doing for all of us. And given some of the things we've talked about, the lag in testing and all of that, our messaging to our employees and our residents is assume you've been exposed or the person next to you've been exposed and behave accordingly. Yes. Thank you very much.
I'm afraid that's exactly right.
Andrew,
Dr. Julian, I would just ask you one other question. That is,
sure.
We were having a conversation before you joined us, and the conversation was, what does it look like as we exit the pandemic, at least the current level of control? And, I think that while it is speculation, we'd certainly enjoy to hear your perspective on what it looks like as the governor relaxes the stay-at-home order.
That's a great question. I've been thinking about that myself. And I will tell you scientifically and from a medical standpoint, my answer is going to be a little bit of a downer. Then I'll say it from a citizen standpoint. But from a medical standpoint, I think we're starting to win here. And by that, I mean, I feel a lot better about this. And the information and data I'm looking at, I think, is getting better. Now, by having said that, it doesn't mean that the number of cases is not going to increase. They are. The cases numbers are going to increase. And unfortunately, our mortality numbers or our death numbers are going to increase too. That's going to happen. However, when you look at these curves about when our peak may occur, they're moving back. We are bending the curve down by all the things we're doing. So I'm encouraged that the things we are doing that we can do when we have so few arrows in our quiver, so to speak, to fight this, we're doing, and we're starting to win. So I don't want to lose the ground we've gained. If this is a war, I think we've gone through Pearl Harbor, and we're not like at this point like the Doolittle raid in World War II. We're fighting back. But that wasn't all that needed to be done. We had to go through the entire Pacific and win back island by island. And so I don't want us to lose sight that still needs to be done. The governor and the BDH, along with national consultations, will try to give the best advice possible about when we can return to a more normal world. And I believe the current order from the governor is through the 10th of June. That was based on the earlier models, where it showed the peak would be latter part of May. So as time goes on, now speaking as a citizen, I'm hoping that we don't have to go that long. But I don't want us to lose the ground that we have gained. One thing that we do not know for sure right now is whether there is a second peak. And let me just mention one thing. A lot of times with the normal flu, healthcare professionals know that in a flu season that, say, runs from the fall of one year to the spring of the next, sort of over the winter time, often clinicians will see a spike in the number of flu cases in the early December timeframe. And then often in January, you'll see a fall in the number of cases, a drop, a decrease. Then to be followed in late February by another spike again. So we know that from influenza. We don't know that with COVID-19 yet. And so I don't want to experience that. So I don't want to let go of the things that we're doing well. But I do want to see us get back on track, and I do want to see our economy and go back to superior function, and I do want us to get back to our normal lives. But I think for now, we've got to do like the people did in World War II. We've got to see this thing through. And so our generation, it's time for us to do that. And I just want to caution, let's go cautious. Let's go slowly here and make sure that we're winning.
That's certainly good advice, Dr. Julian. Thank you. I think that COVID-19 and the public health emergency has presented a lot of challenges to our communities and certainly to government. Probably one of the biggest of those has been information sharing. And I think that you taking the time to do this today has been a big help. And on behalf of the city of Williamsburg, thank you.
Well, it's been my pleasure. And I just want to hold up and lift up the folks at the Virginia Department of Health. Our team has really been honestly working tremendously hard, pulling together a lot of data, information, contacting. We're tracing over 1,000 people now who have been contacts. So it's a Herculean task. I also want to just kind of reemphasize what I said at the beginning, and that is how gratified and how happy I am about how well all of the jurisdictions have been working together with all our first responders, all the elected officials, all of the county and city administrators. We communicate on a daily basis. And I think it's part of the reason why we're starting, I think, to see the light at the end of the tunnel here and beginning to get a handle on this thing is a testament and a thank you from me to all of the folks involved fighting this problem. And lastly, the community. I know it's not easy doing the things that the governor has asked, the things that medical professionals are asking, but I think the community deserves a lot of credit for following the guidelines and calling and asking questions. There's no stupid question. All of them are great. And we really appreciate the opportunity to try to get the information out there that we know.
Well, and Dr. Julian, just in finalizing, I would say thank you from James City County. Again, my colleagues and I have been most impressed with you and your team. Nights and weekends, you've answered our calls or texts, and that really has helped us in responding. And as you said to the citizenry, we appreciate their question, their concerns, and we encourage them to keep asking as things go forward. And I'm sure they will, and we'll pass those questions on to you and get them responses. So with that, I would like to thank everybody. We'll see what the response is, and we'll see if we need to do this in a few weeks. But I do want to say thank you again.
Oh, it's my pleasure. We're happy to do it.